Why some students are coming now? Okay. So some students are coming. Okay. Next we'll go for your individual drugs. Here you can see already discussed how the antiarrhythmic drugs are acting at different action potentials. So I have told you how the sodium ion, potassium ion and calcium ions are entering through the cell membrane. This is your cell membrane. So inside cell membrane, some potassium, so all ions are present inside the membrane, but depending on the conditions, they are entering inside, some are coming outside to maintain the balance of these ions. So here you can see here it is called influx of sodium, and it is outside coming, it is called efflux. So influx and efflux. So depending on the different stage, you are observing here how the sodium ion is coming inside, potassium is coming outside. So already told you, depend on the entry of sodium or your efflux of potassium ion. These are called as depolarization, repolarization. Some are plateau stage, means it is a constant and there is no movement, and sometimes rapid repolarization if calcium ion is involved here. So these are the different stages of the action potential. At different stage, different drugs are acting. So you should know what are the different stages. I think in pharmacology also you will deal with same things. So you should be thorough with this system, how the drugs are acting. Okay. Next, this antiarrhythmic, I already told you, the arrhythmia means irregular heartbeat. So you have to maintain the heartbeat by using your proper medications. So it may be too fast or too slow, or maybe sometimes irregular. So if it is too fast, it is called tachycardia. If it is too slow, it is called bradycardia. So these are already discussed. You see how the normal heartbeat is going on here. So it is mainly represented by PQRST, but in case of irregular, you may be having different rhythms like this. So you see how the tachycardia and bradycardia, extrasystoles, these are how it is going on. So in your electrocardiogram, you will see this graph. By this way, you can observe that how the heart is working. So these are different types of arrhythmia. So these are different symptoms. From this, you can confirm that you have cardiac arrhythmia. So these are main the 7 signs and symptoms. So these are different causes already. Medications, or you can go for cardioversions. You can give some electric shock to maintain the normal rhythm. Okay, so these are different classifications based on the different action potentials. Action potential, different types. So these are different phases already discussed. So these are the different drugs I have discussed already. Disopyramide is the first drug, class 1A drug. These are the synthesis. So these are the SR studies. Depending on the structure, you have to design how the groups are responsible for the particular biological activity. So based on the structure, you design the activity studies. Then mechanism of action already discussed. So these are some of the drugs already discussed. Who are not present, you go through the materials and read all these things. So what are remaining part, will go one by one. Quinidine already discussed. Then SR study of quinidine. It is the stereoisomer of quinine, which is anti-malarial drug, and this is the antiarrhythmic drug. These are the mechanism of actions. Lidocaine already discussed. This is the synthesis of lidocaine. SAR studies, mechanism of actions. Then we'll go for tokainide. Tokainide is another new drug which is available in hydrochloride salt form. So in salt form, most of the drugs are active. Okay. So this is the again analog of lidocaine, amine analog of lidocaine. So it is having similar structure. Some difference is there. You can see here NHCO is there, amide group, but it is not having any amide group. Sorry, it is also amide group, but it is a amine derivative. Here NH2 is there, side chain, not CH3 is attached here. So that side is called amino analog of lidocaine. So here you can see the nomenclature propanamide. I have given propanamide is the parent part. So propanamide here 1, 2, 3. So 3 carbon propane with amide, CONH2. Propanamide, okay. 2 position amino group is there, 1, 2. 2 position amino group is present. At N position, 2,6-dimethyl phenyl. Here N represents this N position. You have 1, this is 1, 2, 3, 4, 5, 6. So 2,6-dimethyl phenyl. So propanamide. So this is the nomenclature. You can go through one by one. Next we will go for SAR studies. So in SAR studies, again I told you, based on the structure you decide your SAR studies. Different points are given here. So you see here the methyl group is present at 2 and 3 position. So this is number 1, suppose, because next this is the amino group. So number is 1, 2, 3, 4, 5, 6. Okay. So 2 and 6 position you should have methyl group. So if the position of methyl group will be changed, suppose here and here, it may diminish the activity. So it should be at 2, 6 position. Okay. Next, presence of phenyl group, it is mainly responsible for lipophilic property of the drug. So any structure is having phenyl group, you can write that it should have lipophilic nature, because lipophilicity will be increased by using the phenyl nucleus. So most of the compounds are having aromatic structure or phenyl group is there. That's why your drug is biologically active. Okay. Next is the increase or decrease in carbon chain. So here you have carbon chain here. It will increase or decrease presence of ethyl amino groups. Here you see CH3, CH2, NH2. This is the side chain here. So this side chain is required for binding of the drug with receptor. I told you how the drug is binding with receptors. So these are the side chains mainly responsible for proper binding. So this is again biologically inactive. So if hydrolysis is there, it will assess the activity. So by this way, you can write your SR studies. Okay. Then what are the mechanism of actions? So it is mainly preferentially bind to the inactive state of sodium channel. So it is also a sodium channel blocker. So generally in Purkinje fibers, in that part only, Purkinje fiber is also a part of your cardiac muscles. So in that part only it will block the sodium channel, so that the heartbeat or cardiac impulse will be regularized. So this is the mechanism of your drug. Then uses it mainly responsible to treat seriously heart disease or heart. It will maintain the heartbeat pattern. If it is irregular, it will maintain to regular stage. Okay. And these are the common side effects of your tokainite. Maybe dizziness, you will not feel comfortable, tired, upset in stomach. So most of the cases you have stomach problem. You may get some ulcers or you may get some bloating or gas problems. And nausea, vomiting, decreased appetite, you will not feel hungry, and diarrhea. So most of the cases, these are similar type of side effects. You can write easily in your exams. Okay. Next we'll go for mexilatin hydrochloride. It is also a hydrochloride salt, but mainly it is having local anesthetic action, and sometimes due to blockage of the sodium channels, it is also used as an antiarrhythmic drugs. It is under class 1B. So it is having similar structure with lidocaine, but here CONH2 is not present. Carboxamide or amide group is not present. Okay. So here only the ether linkage. This is the ether linkage. Why some students are coming one by one? Stop your audio. Some students are coming and making noise. Okay. So this is only the ether linkage. Okay. Then we'll go for IPSC names. So here you can see propane to amine have taken as a parent part. Some students are making noise. You stop your audio. So here this methylatin, you can see propane to amine. This is 1, 2, 3. So propane to amine. So in that you can see here. So this is the 2,6 again 2,6 position. Methyl group is there. 2,6-dimethyl phenoxy. This is phenyl with oxygen. It's called phenoxy. So 2 and 6, 2,6-dimethyl phenoxy, propane to amine. Propane means 1, 2, 3. 3 carbon means propane to amine. Okay. So this is the nomenclature for this drug. Next we'll go for SAR studies. You can see here again same thing I have discussed. So here you see methyl group is at 2 and 6 position. If it is present at 2, 6 position, it is mainly required for your activity. If we change the position, there may be change in the activity, or it may be losses the activity. Okay. Then presence of phenyl group same, it is required for your lipophilic property of the drug. Okay. Then increase or decrease in carbon chain. Here you see the carbon chain. If you will increase or decrease, there may be losses the activity. Presence of ethyl amino group. Here CH2, CH3, CH2, NH2. Ethyl amino group is also required for your binding of the drug with receptors. Then breaking of ether linkage. So ether linkage is most required for this activity. If you will break this ether linkage, then there may be losses to activity. So these are the different SR studies of this drug. Then what are the mechanism of actions? So it mainly produces its antiarrhythmic effect by inhibiting the inward sodium current in cardiac cells. Inward means influx. If sodium ions are coming inside, it will inhibit. So thereby reducing the rate of rise of cardiac action potential. If sodium ion is entering inside the cell membrane, then cardiac impulse will be more. So it will cause again tachycardia. So in that case, it will reduce and also decrease the automaticity in the Purkinje fibers. So in Purkinje fiber, if sodium ions are coming inside, there will be more heartbeat in the area of Purkinje fibers. So it will decrease the automaticity. Automaticity means automatic rhythm will be there. So it will decrease in the Purkinje fibers. So this is the meaning of this sentence. Then it also slow nerve impulse in the heart and stabilize the heartbeat. So there is also common nerve impulse will be there in the heart muscles. So it will make it slow and stabilize the heartbeat. So this is the main mechanism of mexilatin. Then sometimes you may get question of metabolism. How mexilatin is metabolized? So it is mainly metabolized by oxidation or sometimes reduction in case of liver. So liver is the main site of metabolism. So by oxidation or reduction, it may be metabolized. So you sometimes you go through the metabolism study of the drugs. Then it is used mainly for the treatment of arrhythmia in case of Purkinje fibers. So in Purkinje fibers, there may be more stimulation, so it will be controlled by this drug. Okay? And these are the common side effects. You may get some heartburn, you may get some chest pain, upset of stomach, nausea, vomiting. So these are the common side effects, or you may get some blood visions. So maybe your optical nerves may be damaged. Sometimes you are taking serious, suppose some drugs of more dose. So it may cause sometimes blood vision. Okay, problem with coordination with different activities. So your activity may be changed by using some this extra dose of the drugs. So it should be maintained properly. So this is related to your this mexilatin. Then is lorcainide hydrochloride. Lorcainide hydrochloride. It is also a class 1C drug. So under 1C category, it is named. So it will restore the normal heart rhythm and conduction in patients with premature ventricular contraction and ventricular tachycardia. So mainly in case of ventricles, there may be more contractions. That is called premature contraction. Means this is the abnormal contraction in the ventricles of cardiac muscles. In those cases, this drug is mainly useful. So based on the different parts of the cardiac muscles, different drugs are acting. Sometimes it is arterial or ventricle or Purkinje fibers. So you should remember properly the drugs which are acting on different parts of the cardiac muscles. Okay, so this is the structure of this lorcainide. Here you see CH2CONS2. If it is like this, suppose, then it is called acetaminoid. 1, 2. 2 position, phenyl is there. 2 phenyl. Again N position, isopropyl piperidine 4YL. Isopropyl, this is isopropyl group. This is branched. If it is straight chain, it is called N propyl, normal chain propyl. This is isopropyl. 1, 2, 3. 3 carbon. So isopropyl group attached with piperidine. Piperidine means pyridine means 6-membered ring with nitrogen. Fully unsaturated is called pyridine. Then piperin, then piperidine. So piperidine 4YL. 4YL means 4 position it is attached. At 1 position isopropyl group, 4 propyl it is linked with nitrogen. That's why it is written N position isopropyl piperidine 4YL. Okay, it is clear now. So acetamide, CH2CONS2, acetamide, N position 4 chlorophenyl, another 2 position phenyl group. Here this position isopropyl piperidine 4YL. 4 position it is attached, that's 4YL. So this is the nomenclature, or you can say IPSNL. So for GPAT exam it is required. Okay. So what are the structure activity relationship studied here you see. So here fluoro group. Fluoro group means it is a electron withdrawing group. So if it is present electron withdrawing group at para position, then it will potentiate the activity. So the activity will be potentiated, means increased. Okay. It will change this fluoro group with other electron donating groups like a methyl group or ethyl group or any alkyl groups. So that cases you may change the or decrease the activity. So electron withdrawing group mainly responsible to potentiate the activity. Okay. So here again the change in position of fluoro group diminishes the activity. It will change the position. Suppose para position will be changed to other position, it may decrease the activity. So you have to maintain the position of the fluoro group here. Next, presence of phenyl group. Okay, so presence of phenyl group again required for your lipophilic property of the drug. Okay, then presence of piperidine nucleus here, this piperidine, it is also required for your activity. It will replace with other heterocyclic nucleus like pyridine also, pyridine, pyrimidine, any other heteronucleus, it will reduce the activity or it may be losses the activity. Then again same, CONH2 group is there, amide group. It will hydrolyze this amide group, it will losses the activity. So these are the common things you should remember. Easily you can write in your exam. If you remember the structure, you can write everything, very easy to write. So don't hesitate to study your medicinal chemistry. It is mainly required for your future purpose. And basically nowadays in COVID-19, computational study or computational chemistry or drug designing mainly required to get the new drug molecules, because your research or drug discovery process is 10 to 12 years. You cannot do now easily. So by computational study, you can get the new drug molecules to find out whether it is suitable for the treatment of coronavirus or not. So this chemistry is most required. Okay. Next we'll go for mechanism of actions. So here you can see it is also involved to block the sodium channels. Most of the cases it is sodium channel, but you should remember in which part of the cardiac muscles they are acting. Okay, then uses, it helps to reduce normal heart rhythm and conduction in patient with premature ventricular condition. Again same thing in ventricle also. If any premature contraction is there or impulse is there, it will be reduced. Then another is called ventricular tachycardia. If any increase in heartbeat in ventricle, it will be reduced. And another is the important point you can remember for your GPAT exam. Another syndrome is there. It is called old Parkinson's White syndrome. So particular this drug is used for this syndrome. You remember. So this syndrome, what is the meaning? It is a pre-excitation syndrome in which individuals are predisposed to supraventricular tachycardia or tachyarrhythmia. So in case of ventricle, it will give some extra heartbeats or irregular heartbeats. That is called old Parkinson's White syndrome. So you remember this point for GPAT exam. Then what are the common side effects? You may get some insomnia or you may not get proper sleep. And another is gastrointestinal symptoms like gastric or stomach upset or bloating or gas problems you may get. So these are the common side effects of this drug. Okay. Next we will go for sotalol. Sotalol is mainly used for beta blockers. You know, I think adrenergic beta blockers. So this is one of the example. You have so many drugs, but sotalol is mainly here beta blocker used for the antiarrhythmic purpose. It is classified under class 2 antiarrhythmic drugs. So it is a methane sulfonamide derivative. Here see, this is SO2NH2. It's sulfonamide. Methane group is attached. So it is called methane sulfonamide derivative, which was developed in 1960. Okay. So it is having the structure here. You see, N-phenyl methane sulfonamide, in which phenyl group is substituted at position 4. So in phenyl group at position 4, this is attached, and 1-hydroxy here you see, 1-hydroxy 2-isopropyl amine, ethyl group. So this is your side chain attached at 4th position of this phenyl group. Here you can see the nomenclature. I will tell you, methane sulfonilamide or sulfonamide or sulfonamide, same thing. So here you see at 4 position, you can say here 1, 2, 3, 4, 1-hydroxy, 2-isopropyl. Here suppose 1 position, 2, 1, 2. 2 position you have isopropyl amino group, isopropyl amino ethyl. Okay, so this is the nomenclature. 1, 2, 2 carbon is there, ethyl, isopropyl amino ethyl. Okay, 1. So based on this structure, you can go for SR studies. So here you see this is the secondary alcohol. So it should be present at this position. So here you see modification. Okay. Next, presence of phenyl group. Here it is also required for lipophilic activity. Then the increase or decrease in carbon chain, you see here carbon chain 1, 2. So it should be fixed. If we will increase or decrease this carbon chain, it will assess the activity. Next is presence of isopropyl amino group, this one. This is required for your binding of the drug with receptors. Then methane sulfonamide group here. It should be methane sulfonamide. If it is replaced by with ethyl or propyl or butyl, any other alkyl groups here, so there may be change in the activity or loss of the activity. So it is mainly required for your antiarrhythmic activity. Okay. What is the mechanism of action? So it is mainly inhibit the beta-1 blocker or beta-1 adenoreceptor. So in the myocardium, as well as it also block the potassium channel to maintain the slow polarization, lengthening of QT. If QT waves are more, there will be more heartbeat. So you have to slow the repolarization and also lengthening of the QT interval. And also it will shorten the conduction of action potential through atria. So in atrium only it will be active. So you mention in particular area of the cardiac muscles, so they are inhibiting the conduction of action potentials. Okay. Then these are the common side effects like nausea, vomiting, swelling of faces. So your face may be swelling due to more dose, or swelling on feet or legs or fingers sometimes. So this is another extra side effects you can remember. So you should take properly the medications or proper doses. Then uses it is used for treatment of both atria and ventricular arrhythmia. So these are the common uses. Next, another drug is amiodarone. It is a class 3 drug. So it is mainly a potassium channel blocker. Okay, amiodarone. It was discovered in 1961. So it is having the structure here. You see. So here diethyl amino group is attached. Diethyl CS2 CS3 CS2 CS3. Diethyl amino group. Here you can see he is asking question. Okay, so as for the structure, you can know the IPS name. So here diethylamine, here you see 2 position followed by 4th position, 2 butyl, 1, 2, 3, 4. So 4 carbon here, 2 butyl, because 1 and 2 position. Pirate is oxygen here. So 2 position, butyl group is there, benzofuran 3YL, 1, 2, 3. 3 position remaining part is there. 1, 2, 2 position, here you have butyl group. So here benzofuran, this is benzene with furan. So benzofuran, 3 position, all remaining part is attached, that's why it is called 3YL. Carbonyl, this is carbonyl group. 2, 6 position iodo group is there here. If we consider this one, 1, 2, 3, 4, 5, 6. 2, 6 position iodo group is attached. 2, 6 iodo phenoxy, phenyl with oxygen, phenoxy, ethyl, this CS2 CS3, ethyl, diethylamine. So like this you can divide the structure properly and write the nomenclature. Okay. Then depending on the structure you decide the SAR studies. Here you see presence of phenyl group is required for your activity or for your lipophilic property. Then presence of carbon chain, here increase or decrease. Here you see CH2, CH2. So these two carbons should be there. If you increase or decrease in the side chain or this chain, it will decrease the activity or losses the activity. Next, presence of diethyl amino group. This is amino group. Diethyl amino group. It is required for binding of drug with receptors. Next, presence of electron withdrawing group. Here you see two withdrawing groups are there. That is iodine. It should be at 2 and 6 position. If we will change the position of the drug, that iodine, it will losses the activity or reduces the activity. Then another important nucleus is there, benzofuran. So this heteronucleus should be present. If we will replace with other heteronucleus like pyridine or pyrimidine or benzothiazole, and oxygen if we replace sulfur, so it will reduce the activity or losses the activity. So based on the structure you can write your SAR studies. So what are the mechanism? It works primarily by blocking potassium channel or potassium currents. What are coming out, you should maintain the potassium level in the cell membrane of the cardiac muscles, which are responsible for repolarization of the heart during phase 3 of the cardiac action potential. So you should mention the structure here and the action potential so that you can know what are the phase 3, what are the repolarization stage. So all these things you mention in your exam. So I have given one diagram you can maintain for your exam and give the diagram at particular part. So what are the phase 3, how the drugs are acting at this stage, you can write directly. Okay. Then common side effects, nausea, vomiting and fatigue, tremor. So you will feel some jerking like your epilepsy. So your body jerking will be there. Then constipation maybe sometimes, insomnia, sleeplessness, headache. So these are the common side effects you may get. Then what are the different uses? It is a potent antiarrhythmic drug used to treat ventricular arrhythmia and atrial fibrillation. So what is atrial fibrillation and ventricular fibrillation? Everything I have discussed. You maintain the particular points here for your exam. And last drug is phenytoin. So phenytoin is originally used for the treatment of epilepsy or seizure. That is called anticonvulsant. Means it will treat the convulsion. Convulsion is nothing but seizure. What is seizure? If there is excess discharge of electrocardio, EEG, electroencephalogram. Okay, excess discharge of EEG. Okay, that is in brain. But sometimes it is also acting on sodium channel and calcium channel. That's why it is also used for the treatment of arrhythmia also sometimes. So if they are having both cases like epilepsy and arrhythmia, you can prefer this phenytoin drug. Okay. So in that case, so it is mainly in Purkinje fibers. In cardiac muscles, Purkinje fiber, it is inhibiting the sodium channel and calcium channels. So this is the most important drug for combination of both diseases. In those cases, you can use. So here you can see your parent nucleus is hydantoin derivative. This is a hydantoin. Okay, or otherwise called imidazolidine 3,4 position. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So 2 and 4. 2, 4 position if carbonyl group with imidazole nucleus. Then it is called hydantoin. So this hydantoin 5 position phenyl group is attached, 2 phenyl group. That's why it is called 5,5 diphenyl imidazole. 5-membered with 2 nitrogen at 1,3 position is called imidazole. You see here 1, 2, 3, 4, 5. So 1,3 position nitrogen is present at 5-membered ring. Then it is called imidazole. So imidazole 5,5 diphenyl imidazolidine 2,4-dione, 2 and 4 position. Dione is there. 1 and 3 ide means 3 position, no double bond. That's why it is written. Then mechanism, it is also a class 1B drug and it shortens the action potential and inhibits the rapid inward of sodium current. So it is generally inhibiting the sodium ions. So this is the main mechanism of this phenytoin. Then common side effects like headache, nausea, vomiting, constipation, and sometimes drowsiness, not feel comfortable, or sleeping problems. So these are the common side effects of this phenytoin. So it is mainly used for the treatment of seizure or epilepsy. Okay, and now you can use for antiarrhythmic purpose. So these are the main uses of this drug. So these are all about your antiarrhythmic drugs of your unit 3. So you go through all the materials provided by the BPUT also. We have designed for you. You read, same thing will be there. But if you have any doubts, you can clarify on next class. So if you have any doubts, you can ask now also. Just a minute. You can write on chat box. I can give you answer. Any doubts? Avantika, unmute yourself. Avantika. Anybody is having any doubt, you can ask me. Aman. Unmute yourself.
Sir, amiodarone IPS.
Amiodarone.
Yes, sir.
Just a second. Yes, here. You see here, diethyl amino group is there. Here, diethyl amino group. Okay. So here you go directly here, the last. So 2-butyl, here this is, suppose this is benzofuran nucleus. So this is benzene with furan, 1 and 2. So oxygen is first priority. Next to 2 position butyl group is there, 1, 2, 3, 4. So butyl is third chain. So butyl group is there and 1 benzofuran, 3YL. So benzofuran nucleus 3 position, 1, 2, 3. 3 position, other rings are attached or side chain is attached. What are the side chain? This is carbonyl group. This is one carbonyl group. Then you go for this part. That is 2, 6. 1, 2, 3, 4, 5, 6. 2, 6 diiodo phenoxy. Phenyl with oxygen. Then ethyl. Then continue this one. Like this you design your nomenclature. Okay? Any other doubts? Somebody asked what is the difference? Tell me.
Sir, amiodarone डाइपेसिन 26 जो बेंजीन रे जो 2 आयोडो लागि सेटा 26 को केमति सर सेटा नंबरिंग टा होची
26 टा 80 it is here, you see, starting from here, one position, because
ओहो
oxygen is one of the functional group. 2 3 4 5 6 hala. Now it is clear, because here it is one attachment with oxygen. You start from here, because suppose
yes
OH
sir
is here, suppose you will break the structure, it will be OH. Suppose OH is the functional group, so first priority is 1 here, 2 3 4 5 6. Suppose phenol is there, so you will number from here. Okay, so 1 2 3 4 5 6. So 2, suppose 2 6 diphenyl or you can write 2 6 diiodophenol. So OH is here, so you number from here starting. Understood? Any other doubts? Somebody is asking what is the difference between class 1A and 1B. So depending on this mechanism of actions on particular position of the cardiac muscle, suppose in atrial or ventricle, or some are blocking sodium channel, some are blocking potassium channel. So based on that you see the difference, class 1A, 1B, like that. Okay. Any other doubt? I can take your attendance, you give your presence. I'm taking your attendance, give your presence now. One notification for you, we have one program on 28th Friday. So I will send you the link, you go for registration. Okay? Then attend the program from 11 onwards on Friday. So without registration you cannot enter the seminar. So first you register today, I will send you the link to your WhatsApp group. Then you attend the program to get your certificates. It is based on your this classes also, it is similar to your class. So one of the company from New Delhi, they will organize this program. So you be present on that day. You may not have this classes, regular class, so you should attend the program. It is clear to all of you? Yeah. Any doubt, or we'll stop the program? Just wait, I'll send you the link on the chat box. You click on that and register yourself. It is audible to you?
Sir.
Just wait, I will give you the link. You just register now. It is compulsory to all students. You register yourself. You see the link I have given on the chat box. All of you register your name, college name, your email ID properly right there, so that you will get the link for your participation. Attend the program on 28th at 11 a.m. So to get the e-certificate, should present throughout the session. It is compulsory for all students. Our college is organizing this program in association with Lexicom. That is a company provided from Delhi. All of you got the registration link?
No, sir, not got
I
yet.
already sent your, you see the chat box now. Chat box you see here?
No, sir, not in chat box.
Very send, you see, it is common to all. You see now? You see now? Because I think
No,
it is
sir.
going to Vikas only. Okay, just wait. Okay, sorry. I'm sending. You see now?
Yes, sir.
Coming now?
Yes, sir.
You register this, click the link and register. You give your details properly, your phone number, email address. All of you do registration and confirm, okay? Okay, now I'll stop the program, stop the class. Anybody having any doubt?
Thank you, sir.
Okay, bye. Have a good day.